If we're going to breathe really well, then it's useful to pay attention to the tightening or tensioning of muscle groups, and particularly tightening or tensioning that is unhelpful for optimal breathing. Now, nearly everybody has stress-based patterns that they have created through their personal history, through their stories. You know, we copy the way our parents move. We copy the way our parents breathe. You know, we entrain and build into the system patterns from the culture. You know, I was looking at a film the other day, and there was some kind of macho men who are, you know, trying to look like they were sweating and working hard in some. It was a trailer for a film, and they were doing this thing, and they were all mouth breathing. They were all going, and I was looking at it thinking, that's really dumb. But that kind of imagery is going out into the culture as something to attain, something to look up to, something to consider as strong. And of course, it's nonsense. So we pick up information when we're young from all sorts of different sources, and we build it into our system as a way of managing the complexities of life. And that's built on certain biological patterns and certain biological tendencies as well. So we're going to have a look at some of this stuff and learn how to look after ourselves in terms of undoing unnecessary tension and creating more optimal breathing. So the first stripe we're going to look at is around the masseter, the oral band here, around this stripe. We're going to work around this part of the body here. So stuff around the neck, around the jaw, around the head and brow. Now, these muscles here, the chewing muscles, are often used for concentration and focus. If you look at kids in school, you know, they're focusing something in the jaw, and you might even notice it yourself. You might notice that when you're focused and when you're stressed, these muscles start doing interesting things. Sometimes you can get asymmetric tightening. You know, this muscle might tighten more on the left side than the right side, and you might notice that you chew more on one side than the other side, for example, or one side's a bit achy in the joint. So you can get various different patterns arising from this. So the first stripe we're going to do is down from the top of the head here, where the big masseter muscle joins up onto the skull here. We're going to start just above that here, and we're going to get the fingers and kind of hook them in. So it's curling them in onto the top of the head here in this area here. And then sort of gently pulling down. Yeah, it's keeping that kind of like little gentle inward, downward hook happening, drawing down. Now I'm going to go through that, but first of all, before we go into that, we've got to get some breathing going on. So nice, steady, rhythmical breathing. Through the nose, in through the nose, out through the nose. At about a 6-second inhale, 5 to 6 second inhale, 5 to 6 second exhale, so equal breathing. Now the breath is a way of accessing the mind. One of the reasons we do this kind of between 4 and 6 second inhale and exhale in physical movement type practices is because it relaxes the mind. So if you've got tensional patterns, say up here, yeah, and you press into those, that's not going to be very comfortable. It could be very uncomfortable, but certainly one of the outcomes of that is a stress response. So if you're not approaching the mind through the breath to relax the mind into the experience, what you end up with is more tightening, not less. So the breath is absolutely crucial within the movement. There's no point in just moving if there's tightness there, because it's not necessarily going to do very much. You have to approach that with the breath. So you're going into the mind through the breath and into the mind through the body at the same time. So the breath, through the nose, spread the nostrils, rest your tongue if that feels helpful right now, yeah, and get at least 5 to 6 second inhale. That's 1 and 2 and 3 and 4 and 5 and 6. Exhale, 1 and 2 and 3 and 4 and 5 and 6. Inhale, 3, 4, 5 and 6, and exhale, 3, 4, 5 and 6. That kind of rhythm to the breath. So we're doing the manual movements, all of the following movements, with this quality of breathing. So coming back in here, hook in, yeah, get that kind of feeling of like just hooking in gently, and you're going to pull down, like gently clawing down these muscles here. Hook in, breathing, drawing down from the top of the head, down the side of the temples, all the way down. All the way down into this area, just the side of the eyes. And you'll come in and your fingers will feel the zygomatic arch, this bony arch, the cheekbone. Yeah? And just above that, we're going to do some small, slow circles. Yeah? Going in one direction, say backwards first, and then forwards. Somewhere between 4 and 9 little circles each way. And then slide the fingers up a little bit, or rehook them in, slide back down through those tissues onto the arch, release the jaw, breathing through the nose, over the arch, and we hook back into the muscles just underneath the arch here, and sliding down now, breathing through the nose, sliding down all the way down, putting the jaw down, and release through. Now do these stripes 3 times. 3 is enough. There's enough information into the system to induce change. So again, do it 3 times. The second time, come up, rehook back in, sliding down, front side of the skull, breathing well, into the zygomatic arch, just above there, circles each way, slow, steady. Over the arch, back into the muscles underneath here. Make sure the jaw is fully relaxed and released. Sliding down now. Into the back of the jawbone here. You'll feel the angle at the back of the jaw with the index finger, and then down along the jawline. You can bring the fingers underneath the jaw, but we're going to go there in a moment anyway. Before we go to the third time, we're going to come in with 2 fingers here like this, just in front of the tragus of the ear, the top of the temporomandibular joint, just in here, and just do some little pressure circles, tiny, tiny circles, just above the joint here, drawing that down, little circles first, and then drawing down around the back of the joint, and pressing in onto the tragus just in front of the ear. And then stroke down the back of the joint here. 1. Again, little circles just above the joint. And then open the jaw, slide down here, just from the back of the jawbone. So circling just around the inside of the ear. Circles there. And wonderful. And I'm going to come into the third stripe down. Hooking in. Slowly, slowly working down. It's a slow movement. No point in going fast. Take your time with it. Breathing, breathing. You've got to go at the speed of the fascia, which is what it is. So you're going slow, feeling into the fascia there. Letting it release underneath the fingers. And just keep a few breaths to finish. Now that feels substantially different to me, and I trust it will to you as well. So explore that, play with that. That's a really good practice to get under your belt in terms of liberating around the face here. Now the face is very important in breathing, obviously, because the breath comes through the nose, right? And if the muscles around the face are tight and held in tension, it's going to affect the way you breathe, and it's going to affect your psycho-emotional response to the breath as well. So it's an important practice. The second of these practices is very simple again, just striping across the forehead. It's very easy. So from the fingers in the middle of the forehead here, and just working outwards again. Get that breath working. 6-second inhale, 6-second exhale. Just striping out across the forehead, and then down the outside of the eyes, and then releasing. 3 simple stripes like this. Across the forehead. How many of you tense your forehead muscles when you're stressed? How many people do? How many people you walk around with big lines here? Yeah, stretching that open, just releasing all those structures. Going down with the breath, breathing, 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 and then release. Just take it off. Great. So second movement. Next movement, working with the eyebrows. So we're going to take the eyebrows, pinch the eyebrows between the fingers and thumb like this, yeah? And gently just pull them out away from the skull very slightly. Just drawing them out, teasing them out away from the skull. Soft, easy movement with the eyebrows here. That's 3 times again. That's enough movement there. And then take the heel of the hand and just stroke out across the eyes and the eyebrows. Great. There's some massage you can do for the eyes, but we'll do that on the retreat. We'll leave that for now. We'll come to the nose. So around the nasal tissues here, around here. And if you feel with your fingers, you can feel the cartilage at the top here supporting the nose. Yeah, the bony bit, and then it changes into cartilage here. Yeah, and around here you can find the orbit of the nose, where the skull edges are. If you think about a pirate skull, and you've got that triangle in the front of the face, and you can feel that with the fingertips, and you can make little circles around there, around that bony orbit, all the way around. Yeah, great. So having found that orbit, now we can go a little bit deeper with that, okay? First, we're going to strike down the nose with the hands, just drawing down and pulling back slightly around the mouth. So drawing down from the top here, pulling down and drawing back. 3 times. Breathing. And then forwards. We're going to pull that forwards. 1, 2, and 3. Take the nose with the finger and thumb and kind of pull it out of the face a little bit. Just draw it open, lengthening through. Yeah, the top part of the nose, middle and bottom. Just draw it open. And massage with the edges of the thumb, edges of the little finger pad here. Strike it down. Great. All good so far. And then back into the orbit with 2 fingertips. Coming in, little tiny circles all the way around here. Until you get to this point at the bottom, just on the outside of the nares here, the sort of bottom corners of the triangle, of the hole in the skull. And then we're going to do a little micro massage in there at those points. Breathing fully, breathing well as you do it. And then stretch out to the sides. So fingers on and open the nares up here, opening out. Breathing in as you do it. Right, great. And then just rest your fingers on the nares and see if you can stretch those muscles open here as you breathe in, open the nose. And if you snarl a little bit, so be it. 3 or 4 breaths and feel the edges of the nose here, this area and the muscular area here, and see if you can switch those muscles on underneath your fingers as you breathe in. You can let it flicker, let it move, find the movement there. Great. So that's the next area to work with around the nose. And continuing on the face, we're going to work around the mouth and the jaw a little bit here. So with the 3 fingertips, the 3 central fingertips, we're going to massage either side around the mouth muscles, the orbicularis around here. Just gently massaging around the roots of the teeth. You'll feel underneath your fingertips. So you're making these circles here. And the bottom jaw. And stroking off. And the last movement for the face here, for this part of the face anyway, because we're going to jaw and throat in a minute, would be grabbing hold with the finger and the index finger and the thumb onto this bit of the jaw and just gently teasing that out, pulling it away from the face. And stroke the face off. Just stroke everything off. Right. So a substantial difference to facial structure simply by some good massage techniques. Now we can do more, we can do stuff for the ears and so on, and the tongue as well, by the way, but we'll do those on retreat. We're going to leave these on the video. I don't want to do those on the video, so you've got enough to work with there. Now let's go down to the throat now and have a look here. So key muscle structures here are the sternocleidomastoid. This muscle at the front here, which runs from the sternum and the clavicle bone up here, and you can track it up into the skull just behind the ears at the mastoid process. And the trapezius muscle also comes down from here and slides down onto the upper shoulder here, on the top of the shoulder. It slides forward onto the outer third of the clavicle and down onto the back. So we're going to talk to those muscles. We're going to have a little dialogue with those muscles to help those release. Obviously, if those muscles are tightened, that's going to change the way you breathe. Yeah? The muscles, the scalenes on the front of the throat, which you can find behind the sternocleidomastoids here, are also very involved in breathing. They stabilize the ribs when you take a full thoracic breath. So getting those muscles released as well. And those are harder to reach, but we're going to start with the outside muscles here. Right? So very simply, we're going to bring the 2 fingertips, or 3, either way, depends on the size of your hands, I guess, up onto the mastoid process, which you can find behind the ears, that bony prominence. Again, full breath, and simply slide down with those 3 fingers. Now hook slightly like that, so you can get 1 finger, central finger, and the 3rd finger making a little pad, sliding down, sternocleidomastoid, all the way down. And as you do that, if you lift the chin up as well, it really helps it. So you can draw the chin up, land into that muscle. Down to the clavicular sternum area. Again, 3 times. If you get that gentle hook feeling in where you're curling the fingers in slightly, it makes it more effective. So you get that kind of hook in feeling. Sliding down. Lifting the chin. As you come down. That's the 2nd time, so the 3rd time, 3rd strike. Excellent. Now to come down the back of here, I recommend using the thumbs. You can do it other ways, of course, but if you come to the thumbs with the sternum on the mastoid process here, yeah, and then you're sliding down the traps, the upper trapezius here, slowly sliding down, yeah, and we're coming down kind of the midline in between where the trap curls down the back and comes on the front. So you'll find a groove down there which you slide down all the way down here into the top of the trapezius and massage the thumb in there on the top. What I'm doing on the back of mine is using my thumbs and interlacing my fingers so I can get in there with the thumbs onto the top of the traps. There's a trigger point there for the upper traps. You can just gently press, circle in there to release, and then continue to slide that thumb down, inviting the muscle to drop down and the shoulder blades to go down with it. We're going to do 2 more of those in a moment, but just before we do, the upper trapezius is a muscle that is innervated by a cranial nerve. It's the only skeletal muscle that's innervated by a cranial nerve. Just checking if that's true or not. I think it is, yeah. Because what this is this is fired. It has to be active when we're a baby. The rest of the muscles in the body, we find them through movement over time. You know, the sensory motor experience of switching on those muscles comes over time. So for a little infant, it has to have that muscle active so it can find the nipple. So the rooting reflex, which you get with a baby when you stroke its face like this, it turns its head to look for a nipple. And that has to be an active part of the mammalian experience. Mammals suckle, yeah. So that's switched, that's innovated immediately. So it's available for any mammalian baby. All right. So that one is often implicated because the cranial nerve, and we do fascinating things with stress as modern human beings. Oftentimes this upper trap is kind of elevated, tightened, switched on asymmetrically. So coming into that trigger point and stroking down here is a great way of relieving stress, but also deepening in breath work. So again, coming in, thumbs here. There are other ways of doing this, but this is the start. And again, we can do more of this on retreat. So I come in here, slide down here, down that trapezius into the groove between the more anterior portion and the more posterior portion of the upper trap. Sliding down, yeah. And then coming into the trigger point, a little bit of soft massage in there. Hold that and slide away and release. Great stuff. Another approach to this one is to come in with the hands here onto the upper trapezius and gently draw it down. Your fingertips, my fingertips are hooky in the back, into the back of the trapezius here. Palm curling over the top, and then sliding that down and out as I turn my head in the opposite direction. Do that again, one time, just hooking in to the body of the upper trapezius, and sliding that down and out as I turn my head to the other side. There are many other techniques for working with this as well, like turning the head to the side and so on, but that's a really good beginning for working with the head, the face and the jaw, and releasing this structures so that we can pay more attention to the breath, relax more fully, and be more fully in the breath work.